Wow.
So we are moving kind of a little fast today. This chapter
Yeah.
is kind of moving a little fast, right? We are already like so many pages. Here comes the last topic in this chapter, which is medications. Remember, I told you we're going to learn some
Hmm.
medications? Here comes
Yeah.
the medications, okay? So if you look at table 5.1, which is page 156, you're going to go
Hmm.
crazy. You're going to have a panic attack, okay?
You know me too well, huh?
All right. But I have some good news. You don't have to study this table.
Okay.
Instead, I'm going to just explain these things so that you don't have to look at this table at all.
Okay.
Okay? So I'll just explain everything and then I just make you mark a couple of stuff and that's pretty much it. You don't have to look at this
Okay.
table at all. Okay? All right. Okay, so let's study a little bit about medications. Under medications, you can mark the one, two, three, four, five, the fifth line. You can mark from it is important. It is important to realize that many substances, over the counter medications, and prescription drugs affect the heart's response to exercise. This is what we talked about earlier. I told you, right? Steroid, it might or might not affect your heart rate. You never know. That's a reason you need to, ask them or the doctor,
Hmm.
right? So this is what they're telling here. And the next paragraph, third line. If a personal trainer, the third line, next paragraph.
Got it.
If a personal
Hmm.
trainer has any questions concerning a client's medication, it is essential that the personal trainer discuss them with the client and his or her physician. And then the next line also you can mark. If you or the client are concerned about the effects of a medication and its impact on exercise, a medical clearance form can be utilized to seek clarification and recommendations. So let's say this person does not need a medical clearance, yet you are concerned or your
Right.
client is concerned that I'm taking some medications. I don't really know the names of it. It's kind of complicated to say the name, pronunciate it. But I feel that this is probably affecting my heart rate because I don't really feel it while working out. In this case, a
Hmm.
medical release form can actually help you, right? Because the physician is going to exactly mention, okay, you know what? You're not going to see any changes in your heart rate because of these medications. Therefore, you'll probably have to use RPE, like ratings of perceived exertion, to determine how intense the workout is for her, instead
Hmm.
of relying on those Fitbit watches that tell you the heartbeat or heart rate,
Right.
right? So that's what they're telling here. Anyways, that was just an introduction. Now let's look at medications. We have something called as anti or antihypertensives. What is that? What does that even tell you?
High blood pressure,
Exactly.
hypertension.
Exactly. Hypertension is high blood pressure, right? So
Hmm.
it's antihypertensives, which means it is a medication that you're taking to control hypertension,
Hmm.
which means if you take this medication, it's probably going to lower your blood pressure, don't you think?
Hmm.
Or at least going to help in controlling your blood pressure levels.
Right.
Hence the name antihypertensives or antihypertensives. Okay, so you can mark the second line under antihypertensives. Most antihypertensives primarily affect one of the four different sites: the heart, to reduce its force of contraction; the peripheral blood vessels, to open or dilate them to allow more room for the blood; the brain, to reduce the sympathetic nerve outflow; or the kidneys, to reduce blood volume by excreting more fluid. So
Whoa.
now that was a lot of information, right? So let me break it down to you. Okay. So what are they saying? They're telling that these antihypertensive. Do you see just taking an antihypertensive, which all ways it can affect you, right?
Hmm.
So the first we are looking at the heart. So what can it do to the heart? it can actually reduce your heart rate or even increase your heart rate. So it can affect your heart. That's number one
Mm-hmm.
side that it can affect. And I'm not
Right.
talking about side effects. I'm just saying the effect this medication has. It's not going to
Right.
do anything bad for you, obviously, else why would you take
Mm-hmm.
this medication? But it can
Mm-hmm.
have some side effects, like such as your heart rate might go down or up, whatever.
Right.
Right? So it can affect your heart. Second, it can affect your peripheral blood vessels to open or dilate them to allow more room for the blood. What does this mean? So let's say this is your blood vessel. Okay, this is your blood vessel.
Mm-hmm.
So what happens when you're trying to water your plants? What do? You kind of press the tip of it
Right.
like this. That's when a
Mm-hmm.
lot of water comes out, right?
Mm-hmm.
So the same thing is happening inside your body when you're having blood pressure. When your blood pressure is very high, it's just like that water splashing to water the plants. It's the same thing that's happening. Your blood vessels is probably becoming small, and that's the reason the pressure has increased a lot,
Right.
right? So I'm literally holding that nozzle at the edge and I'm trying to water the plants. Imagine that
Mm-hmm.
instead of water, it's your blood, and
Right.
this is the pressure that you're experiencing. So this medication can dilate your blood vessels like this.
Mm-hmm.
So now the flow is going to be like this. Instead of splashing, it's going to be like this. So that's what they mean over here in this sentence, if you look at it. The peripheral blood vessels to open or dilate them to allow more room for the blood.
Mm-hmm.
Now, does that make sense?
Mm-hmm.
Okay. Let's look at the next point, the brain, to reduce the sympathetic nerve outflow. So,
Mm-hmm.
what do you think the brain has anything to do with hypertension or whatever? You might think. But think about it. What if I can calm your brain? It is going to automatically calm your heart, the
Heart.
heart
Yeah.
rate, right? So,
Mm-hmm.
automatically the pressure
Everything
can
just slows
decrease,
down. Mm-hmm.
right? So if you're not pumping that hard, it's kind of okay. The flow is gonna be static or normal. So that's how your antihypertensive can sometimes affect your brain too, right? To reduce
Mm-hmm.
sympathetic nerve outflow. And finally, we have the kidneys to reduce blood volume by excreting more fluid. So let's say let's look at that same example, right? I'm kind of squeezing it and the water is splashing, right? Now let's say a lot of blood is coming. The volume of the blood is super high and the exit point is very narrow. What do you think happened? The pressure is going to increase, right?
Mm-hmm.
So now, what if I can go and affect my kidney and I'm reducing this blood volume, the volume of the blood, I'm reducing this blood volume by taking out a lot of water from the blood via via urination. What do you think will happen? If the blood volume decreases, then the pressure will get controlled, right? So imagine, let's say you have fixed that pipe to your tap, right? And you have turned that tap fully, and you're trying
Mm-hmm.
to squeeze this. A lot of pressure is coming, right? What if I tone down that tap
Mm-hmm.
and there's less pressure now? Now it's not splashing; it's now kind of going here, right?
Mm-hmm.
That's exactly what's happening. That's what they mean. This is how antihypertensives can sometimes affect the kidneys, causing you to urinate a lot, use the bathroom a lot, and decrease the volume of the blood by getting that water from the blood out via urination.
Oh.
This is one more way that antihypertensives can affect you.
Mm-hmm.
Now, if you look at these sentences, it might make a little bit more sense. So, most antihypertensives primarily affect one of the four different sites: the heart, to reduce its force of contraction. So, basically, I'm trying to
Mm-hmm.
drop your heart rate, right? That way, I can bring the blood pressure down. The
Right.
peripheral blood vessels to open or dilate them to allow more room for the blood. And then the brain to reduce the sympathetic nerve outflow, or the kidneys to reduce blood volume by excreting more fluid. Now, does it make sense? These
Yep.
sentences that you
Mm-hmm.
just marked, right? And don't worry, they're not going to really ask you anything from these sentences, but these sentences are going to serve as a way for you to understand the next page that we're going to look
Right.
into. Okay, so this is, so now the next part is going to make a lot of sense. So if you come to page 156, in page 156, you don't have to look at this table, okay?
Mhm.
But you can look what's written below the table. Do you see a star mark?
Mhm.
So what does that star mark say? Many antihypertensive medications can cause positional hypotension, meaning the blood pressure drops when changing positions, sitting to standing. Therefore, a client may become dizzy if he or she moves too fast after performing abdominal work on the floor. So why is this sentence important? Not from exam point of view, it's not important, but this is just for your knowledge. Think about it. Let's
Mhm.
say a client is complaining. She's doing crunches or something, abdominal work lying down. Then she gets up really fast and walks and she's like, oh my God, I'm feeling a little dizzy. I don't know what's happening. So
Mhm.
you can understand, okay, probably she's having positional hypotension.
Mm.
It might not come to your mind at the moment, but you never know, right?
Right.
It might just click all of a sudden.
Mhm.
This information might stay somewhere in your subconscious mind. So
Positional hypertension.
yeah, positional hypotension, where the meaning the blood pressure drops when changing positions, like sitting to standing. You're
Mhm.
sitting and you're suddenly standing up, and you're experiencing it, right? Or your client may become dizzy if he or she moves too fast, after performing abdominal work on the floor. So next we have the client's note. Many medications are prescribed for conditions that do not require clearance. Do not forget other indicators of exercise intensity. Example, client's appearance or rating of perceived exertion. So what they're telling is, just because they do not require a medical clearance doesn't mean you're going to stop observing them. You got to observe them,
Right.
okay? So
Mhm.
you got to check, how is that person's appearance? Do they look flushed out? Do they look tired? Do they look like they're, kind of feeling dizzy or whatever, you know?
Right.
And the rating of perceived exertion, which means you got to ask them, how do you rate this exercise? How do you feel the intensity on a scale of 0 to 10? 0 meaning nothing at all, 10 meaning extremely difficult. Where
Right.
does this exercise fall? That is your ratings of perceived exertion, right? Okay. So when you come to the next page, it's going to make you happy.
Yay.
So you will notice that the chapter has come to an end.
It is? Whoa! Every
Yeah.
chapter should be this short.
Yeah. After a long time, huh?
Yeah.
Okay.
This was quick. You weren't kidding.
Yeah, this is kind of a quick chapter. So this is like a
Mhm.
transition, kind of a break for you, right? All this while it was
Yeah. Yeah.
really
Yeah.
lengthy. This is kind of okay. Okay, real quick, let's look at each of these medications. What is beta blockers? These medications, what are they going to do? So I just want you to mark under beta blockers, you can mark the fourth line. One, two, three, four, five. Sorry, the fifth line. Reduce resting, exercise, and maximal heart rates. So that's what this medication is going to do.
Mhm.
Oh, and by the way, we are still talking about antihypertensives. We're still under that heading.
Okay.
I want you to remember that, okay?
Let me write that down. So.
Yeah. So you can, on top of beta blockers, also you can write the heading, antihypertensives. We are still looking at antihypertensives. All of these things that you see here is all antihypertensives.
All these
All of
medications.
this, all of this, beta
The whole
blockers,
the whole
calcium,
table and
the
everything.
whole the whole
Oh,
page.
okay.
Because if you come to the next page, page 158, they have a different heading. They have a different caption. So all of these things that you see, they all come under antihypertensive.
Mhm.
Okay, so what does the beta blockers do? They reduce resting, exercise, and maximal heart rate. So you can write in short form. You can put a bracket beside beta blockers and you can just write, reduce RHR, EHR, MHR. RHR,
RHR.
MHR, yeah, RHR,
Mhm.
MHR,
MHR.
EHR. Yeah. So what does that mean? RHR means resting heart rate.
Mhm.
MHR means maximal heart rate. And
Mhm.
EHR means exercise heart rate. Does that make sense?
Yeah. Yep. Got it.
So that's like a short form, right? So you just marked reducing resting exercise and maximal heart rate. And then
Mm-hmm.
you can skip the next line and just mark using rating of perceived exertion or the top test versus target heart rate, for example, would be appropriate for ensuring a safe and effective cardiorespiratory exercise intensity for someone on beta blockers. So beta blockers are very important for you in this chapter. I mean, amongst all the medications, beta blockers are the most important, and they like to
Mm-hmm.
ask questions from beta blockers. So you need to know what beta blockers do.
Right.
They reduce your RHR, MHR, and EHR.
Nature. Okay. I
And
haven't flash
therefore,
started with that one. Mm-hmm.
yeah, and therefore you need to use what? You need to use ratings of perceived exertion or the
Mm-hmm.
talk test instead of target heart rate. Instead of target heart rate, you need to use RPE, which is ratings of perceived exertion, or the
Mm-hmm.
talk test to determine the intensity of their exercise.
Use
Because because
talk test.
yeah, tell me what was that?
Oh no, I was repeating what you said.
Yeah.
Use the
So
talk test or the
or the
um
RPE,
or RPE.
the ratings of perceived exertion. Why do you think we are using these? Because we just found out that it is reducing your EHR, MHR, and RHR. So no
Mm-hmm.
matter what assessments you do, it's going to render all the assessments faulty, right?
Mm-hmm.
Their RHR, even if they're doing high intensity exercise, their RHR or their exercise heart rate is going to be low. And
Because of the
you'll,
medication.
yeah, and you'll be like, what is happening? Why is there no change in the heart rate?
Mm-hmm.
Even though I'm giving so intensity, so I'll probably have to increase the intensity.
Mm-hmm.
Wrong. You shouldn't, because they are experiencing a lot of intensity. It's just that their heart rate is low because of the medication.
Mm-hmm.
That's the reason you're using RPE or the talk test, meaning you're asking
Right.
them to recite something like A, B, C, D, the alphabets, and
Mm-hmm.
you're checking how intense is it. Are they able to speak comfortably or are they not able to speak comfortably? The stuff that we studied in IFT model, the base training below
The base
VD1.
training. Yeah, yeah, yeah.
Remember?
Yeah.
Yeah.
Mm-hmm.
All right. Next is the calcium channel blockers. So you can mark the second line, arteries, or you can just mark the first line even. Prevent,
Calcium.
yeah, calcium dependent contraction of the smooth muscles. But the main thing that I want you to mark is the second line. In the arteries, causing them to dilate, which lowers blood pressure.
Mm.
Do you remember we discussed this previously, just now? How if I'm dilating the blood vessel, how the pressure is decreasing. That's why
Right.
this is the reason I discussed that previously. So calcium channel blockers does exactly that. Your
Or
calcium channel
diuretics.
blockers
Right.
does
Mm-hmm.
exactly that. It is dilating the arteries or the blood vessels or whatever, which in turn
Mm-hmm.
is lowering the blood pressure. So calcium channel blockers usually do not have any effect on the heart rate, okay? In case they ask. So you can mark the under calcium channel blockers, you can mark 1, 2, 3, 4, 5, the fifth line. Calcium channel blockers may increase, decrease, or have no effect on the heart rate. So usually you can just safely conclude that it doesn't have any effect on the heart rate because they're telling may increase or decrease, so you don't have to get confused. It doesn't really affect your heart rate. Okay, calcium channel blockers.
Okay. Does not have affect heart
Yeah,
rate.
kind of. You can kind of conclude that.
Mm-hmm.
It's just the beta blockers that reduces or drops your EHR, MHR, and RHR. Then next we have the angiotensin converting enzyme inhibitors. So don't worry, you don't have to remember these names. You have a shortcut for it. We have something called as ACE inhibitors. So angiotensin converting enzyme inhibitors is nothing but your
Mm-hmm.
ACE inhibitors. And that is easy to remember, right? ACE. We are studying
Ace. Yeah.
ACE. Yeah.
Mm-hmm.
So what does ACE inhibitors do? You can mark the third line under ACE inhibitors. The vessels dilate and BP decreases. So it does pretty much the same thing that your calcium channel blockers are doing. It's dilating the blood vessels and therefore the
Mhm.
blood pressure is decreasing, right?
Mhm.
And the next line you can mark: ACE inhibitors should not affect HR, but but will cause a decrease in blood pressure at rest and during exercise. So BP stands for blood pressure.
Mhm.
So it's going to decrease your blood pressure at rest as well as during exercise. So even though it's not really affecting your heart rate, it can lower your blood pressure even at rest, which means
Mm.
what? You might experience some dizziness. What happens
Right.
when you're on low blood pressure?
Yeah.
Or during exercise, if you experience low blood pressure, what happens? You feel dizzy or you feel
Mhm.
nausea or whatever, right? So that's the reason these informations are important. So let's say your client tells you, you know what, I'm on some medication, and you're asking, okay, what medication are you taking, just out of curiosity? And let's say they are telling you ACE inhibitors. Boom.
Mhm.
Now you know, okay, this person might experience low blood pressure at rest or even during exercise.
Right.
So you got to be a little careful about that, right?
Mhm.
Next, we have the angiotensin 2 receptor antagonist. Don't worry, this is not important. They usually don't ask this question. This
Mhm.
medication, for some reason, they don't ask. Not really some reason. It's actually a pretty difficult name to even pronunciate, right?
Yeah.
It's way out of our scope of practice. So, what is angiotensin 2 receptor antagonist? So, so they are a new class of antihypertensive agents. These drugs are selective. So basically, they're telling that you can mark the last line under angiotensin receptor antagonist.
Mhm. Affect blood.
No, not really. Okay, you can mark the third line. Do not adversely affect blood lipid profiles or cause rebound hypertension after discontinuation.
Mm.
So some people they experience rebound hypertension. The moment they stop taking medication for hypertension, they experience hypertension, right?
Mhm.
So this is a medication which does not have that side effect. You're not gonna experience rebound hypertension just because you stop using it. So this is just an
Okay.
information that is, just for your general knowledge.
Right.
So that is enough. Next is diuretics. That is important. Okay, diuretics are important. Remember we talked about the kidneys,
Mhm.
how you're urinating a lot and getting rid of the blood volume. You're decreasing the blood volume by getting rid of some water that is present in the
Water.
blood
Right.
via excretion and urination.
Mhm.
So that's exactly what your diuretics are doing. So you can mark this. Diuretics are medications that increase the excretion of water and electrolytes through the kidneys. And then you can skip the next line and mark the third line that says they have no primary effect on the heart rate, but they can cause water and electrolyte imbalances. So for these clients who are taking diuretics, you need to be careful because think about it. They are their kidneys are getting rid of the water present in their blood just to decrease the blood volume
Mhm.
via urination, which means they are going to the bathroom a lot, they're urinating a lot. What do you think can happen? Dehydration,
Dehydration. I know. Mhm.
right? So I want you to mark the the next line, the line after that. Predispose and exercises to dehydration. Predispose an exerciser to dehydration. So with these people, what advice are you going to give them? You're going to ask them to drink a lot of water. You're going to give them a lot of water breaks.
Yeah.
You're not going to be like, no, some people do. No, you're not going to get a water break until you finish this exercise or this routine. No, that's not
Mhm.
going to work with these clients. You have to give them water. You have to tell them, you know what? It's okay. Let's wait. Once set is over, go have your water. Drink some water.
Mhm.
Keep yourself hydrated because you know that this
This
exercises
medication.
can be predisposed to dehydration as well as water and electrolyte imbalance.
Mhm.
Right? That's why we marked the previous sentence too. So it's not having any effect on the heart rate, mind you. It's only your beta blockers that is decreasing your EHR, MHR, and RHR.
Mhm.
And we saw that the ACE inhibitors are going to are not having any effect on heart rate, but they're going to decrease your blood pressure at rest as well as during exercise. We saw that too, right? And calcium channel blockers, they don't have much effect on heart rate. They're just going to decrease your blood pressure. That's it.
Mhm.
Similarly, diuretics are also not going to have any effect on your blood pressure. I mean, not going to have any effect on your heart rate. They're just going to lower your blood pressure. That's it. That's why you take it, because it's an antihypertensive, right? But these
Mhm.
people can experience some kind of dehydration or water and electrolyte imbalance. So you need to be careful about that. Next, you can mark the last line or last two lines. Diuretics are sometimes used by athletes to try to lose weight for sport. This is a dangerous practice that should not be condoned by a responsible personal trainer.
Oh wow. Is that when they say like you're in competition and they said you're distrusting your body? Like
Exactly.
they just
So
pull
have
like
you
pull it out
heard?
the water?
Yeah, have you heard about these kickboxing competitions where they're like, I need to be in this weight category
Yeah,
in order to compete. So if they take diuretics, what's going to happen is they're going to lose their weight because of that water loss.
the water
They're
loss.
going to lose, and every gram, every this thing matters for them, right? That's going to
Right.
decide whether they're going to be in that category or not.
Mm-hmm.
So they'll take these diuretics, which is not right, and they're going to lose all that weight, and they'll be fit for that category, right?
Right.
So this is a dangerous practice, and we shouldn't condone this. That's what they're telling.
Mm-hmm. Right. Right.
Yeah, the boxers and stuff do that.
Exactly,
Boxing.
exactly.
Mm-hmm.
Boxers, right? It's kind of famous. We've seen it in movies and stuff like that,
Yeah.
right? Yeah.
Mm-hmm.
Next, let's come to the last page, page 158. We have two more medications left, and we are done. One is bronchodilators. So this can probably tell you something, right? It has to do something with your lungs,
Right.
bronchitis,
Bronchitis. Yep.
asthma, stuff like that.
Mm-hmm.
It's kind of easy. So you can mark the first line. Asthma medications, also known as bronchodilators, relax or open the air passages in the lungs, allowing better air exchange. That's it.
Mm-hmm. Now that one I'm gonna remember.
Yeah, right. So if you can also mark the last line in this under this. Have minimal effect on resting and exercise heart rates and blood pressure, which means this is the exact opposite of your beta blockers. It
Mm-hmm.
doesn't affect your EHR, MHR, RHR, or your blood pressure for that matter. It has nothing to do with any of those things.
Right.
It's just gonna, stimulate your sympathetic nervous system and, relax your air passages in the lungs and help you breathe better.
Mm-hmm.
Okay? So you can mark this, the third line under bronchodilators. Bronchodilators increase exercise capacity in persons limited by bronchoconstriction. Or just, you can just mark bronchodilators increase exercise capacity. That's it.
Mm-hmm.
Now we have cold medications. Okay? So under cold medications, we have two types. One is decongestants and one is antihistamines. So I just want you to mark the third line. Decongestants.
Mm-hmm.
Decongestants act directly on the smooth muscles of the blood vessels to stimulate vasoconstriction. So, so let's say you are taking a cold medication, okay, and it has decongestants in it. So
Mm-hmm.
what are these decongestants gonna do? They are gonna stimulate vasoconstriction. What do you mean by vasoconstriction? Vasoconstriction is, so what do you mean by the word constriction? You're constricting something, right?
Mm-hmm.
So vasoconstriction is going to constrict or narrow your blood vessels, which is
Right.
probably going to increase your blood pressure,
Pressure.
right? So decongestants are going to stimulate vasoconstriction. Therefore, I want you to mark the in this same paragraph, the last line of the same paragraph.
Mm-hmm.
Vasoconstriction in the peripheral vessels may raise BP, BP meaning blood pressure,
Blood pressure.
and and increase heart rate at both rest and possibly during exercise. So in case they ask you like what does decongestants do, you can tell them, you know what, decongestants can actually increase my heart rate because you know that it's stimulating vasoconstriction,
Mm-hmm.
right? So it can actually
Like
increase your heart rate
increase
as
the
well as your blood pressure, because what happens if your blood vessels are constricted? Blood pressure is going to increase, right?
Go up. Heart rate gonna
Mhm.
increase.
Yeah, it's gonna go up. Yeah, exactly. Next paragraph, you can mark antihistamines or antihistamines. So after that, you can mark the next line. Do not have a direct do not have a direct effect on the heart rate or blood pressure, but they do produce a drying effect in the upper airways and may cause drowsiness.
Mhm.
So what is antihistamines? So okay, if you just read that sentence, it's gonna make sense. Antihistamines block the histamine receptor, which is involved with the mast cells and the allergic response. So don't worry, I'm gonna break it down. So what this means is, let's say you're having an allergy, you're itching a
Mhm.
lot, right? So there are some histamine receptors here. So antihistamines are going to block these receptors. So the information is not going to go to your brain that there's a foreign object here and I need to itch. So you're going to
Mhm.
stop itching if you take antihistamines, because it's going
Mhm.
to block the histamine receptors that are present in your skin, which is creating that allergic response in you,
Mhm.
right? Similarly, even if you're having a running nose, what is that? It is an allergy, right?
Mhm.
Let's say you're sneezing a lot. What is that? It is an allergy, right? So if you take antihistamines, that's what's going to happen. It is going to block the
Block it.
histamine receptors, which is involved with the mast cells and the allergic response. So this, they do not have any effect on the heart rate or blood pressure. Okay, they do not have any effect,
Mhm.
just like your bronchodilators, but they produce a drying effect in the upper airface, and you may feel drowsiness.
Mhm.
And the next line, they're saying that most cold medications are a combination of decongestants and antihistamines
Mhm.
and may have combined effects. However, they are normally taken in low doses and have minimal effect on exercise capacity. With that, chapter 5 is over.
Wow.
Rats. Good job.
Yes.